This new spasticity treatment is already being used in the US. It's moving through FDA approval right now, and insurance coverage is coming. And most doctors don't even know this treatment exists yet. So if you've tried Botox, you've done your stretching, you've worn your splints, and your hand is just still not opening, stay with me, because this might be the thing that nobody's told you about yet. This new treatment is called Cryoneurolysis, and here's what it does differently than Botox. So with Botox, it's going to temporarily block the nerve signal that's causing the spasticity. It works, but it wears off in about 3 months, sometimes faster than that. And you have to keep going back and getting shots and injections. With cryoneurolysis, it actually freezes the nerve, not permanently, but long enough that the effects can last 6 months to a year or longer. One treatment, a lot longer relief, and because it's targeting the same overactive nerve signal that Botox targets, it's not more invasive, it's just a different mechanism. And here's the thing, this treatment isn't experimental because it's already been FDA approved for pain management. And the research for spasticity is strong enough that it's moving through approval right now. And what I hear is doctors, not only in the US, but around the world, are being trained on how to do it. Insurance companies are starting to cover it as well. So if Botox has worked for you, but just wore off too fast, or if you're someone who's been told we've maxed out what we can do with you with Botox, then this is worth knowing about. And it's worth asking your doctor about too. But here's the thing I want you to understand. Cryoneurolysis isn't a magical fix. It's a tool. It's a more effective tool than Botox for some people, but it's still just buying you a window. And that window is where your spasticity is reduced, where your hand is easier to move, and where the brain has a chance to actually practice the movement patterns it needs to rewire and change. But if you don't know how to use that window, if you're not doing the right kind of practice during that time, you're just kind of going to go back to that tightened back up feeling when the effect wears off. So if this sounds like something worth exploring, then here's what I'd recommend. First, ask your doctor about cryoneurolysis for spasticity. Bring them the research if you need to, and make sure you're familiar with it. And I'll link a few studies in the description. Step 2 is if you do decide to move forward with it, have a plan ready to go when that window opens. Most survivors get the treatment, they feel the relief, and they don't know what to do in that window. And then they go back to the same stretching routine or the same exercises that weren't working before, and they wonder why the spasticity is coming back. So the window is temporary. What you do during that window, it is actually what determines whether your hand actually improves or if it just goes back to the way it started. So you need a structured plan built around your recovery stage, your current abilities, and maybe some specific things that you want to work on towards. And that's exactly what my Stroke Strategy Week does. So if you're interested in getting a plan custom built to your stroke stage, your abilities and your goals, then check out the link for the description and schedule a free video call with me, and we're going to kind of look at exactly what's going on with your arm, and we can actually talk through what your plan would actually look like. So links in the description, and hopefully I'll see you on a video call.